All right, so now we are going to be performing palpation of the thoracic and the lumbar spine. So this is going to include skeletal palpation and muscular palpation, starting with the T1 spinous process. So T1 spinous process is going to be right at the base of the neck. We already found C7, that's the vertebral prominence, the most prominent vertebrae. So from that C7, we are going to palpate just below. There's going to be a gap. And then below that gap, there's going to be another vertebrae. And then you have another gap and then another vertebrae. As we get further down, these vertebrae and the gaps are going to be larger. The spinous processes will be further apart. So you'll notice that as you get down into the further down the thoracic spine, especially in the mid-thoracic spine area. Once we get to mid-thoracic spine at the level of the inferior angle of the scapula, you will be at the spinous process of T7, and then we have T8, T9, T10, T11, T12, right where our 12th rib comes back and attaches to. So you can start from the bottom, find the 12th rib, follow that path up. That's going to take you to T12 as well. So some landmarks we have here: T1, T12, bottom of the ribs. T7 is going to typically be level with the inferior angle of the scapula. So that is the spinous processes of the thoracic spine. The transverse process, finding those can be a little bit tricky depending on the area that you are in. If you are in the mid-thoracic spine, then the transverse process of the vertebrae is actually going to be one spinous process above the spinous process that you are on. So if I am on the spinous process of T7, that vertebral body is actually way up here because these spinous processes are steeply inclined. So if you find the spinous process of T7, walk up to the spinous process of T6, come across about 2 finger widths away, you're going to be over the transverse process of T7. How do I confirm I'm on that? If I'm palpating the spinous process and I apply a pressure to the transverse process, what you will feel is that the spinous process will move away. So as I push on this left side, that is rotating that whole spinous process in that direction. So as I push here, it's pushing it back into that direction. So I'm rotating that whole thoracic vertebrae. So that is the thoracic spinous processes, the thoracic transverse processes at the mid-thoracic region. They're going to get closer as you get into the upper thoracic. They will get closer as you get back down to the lower thoracic. But if you're mid-thoracic spine, you're one segment above. And then we have the lumbar spine. Lumbar spinous processes, where I usually start with this, is at the level of the iliac crest. You are going to be, a good landmark for that is at the level of the iliac crest. You are at the L4, L5 interspace. So there I have a vertebral body above, that is L4. I have a vertebral body below, that is L5. So I can start there. There's L5, there's a gap, there's L4, there's another gap, there's L3, there's a gap, there's L2, and then there's L1 above that, and then I'm back to that 12th thoracic vertebrae. So that is the spinous processes. The transverse processes of our lumbar spine are going to be in the gap above the spinous process. So if I find that L4 spinous process again, and I find the gap above, and I come into that gap, and I press down posterior to anterior, now this spinous process is moving in that direction. If I push into the right, that whole vertebrae is rotating. The spinous process rotates to the right, and the whole vertebrae rotates back into the left, faces the left. So that's the spinous processes, transverse processes, thoracic, lumbar areas. And then we have the sacrum. So the sacrum, if you will find the iliac crest again, which is the top part of our hips, trace it all the way down to where it ends and it hooks back under. That's called our PSIS. In between that area, we have the sacrum. That is going to be the level of S2. So we come in between. That is the sacral spinous process of S2. So we're on the sacrum at that location. And then the ribs are obviously going to cover this whole entire area. If you wanted to start as you're locating the ribs at the 12th rib, our 11th and 12th ribs are going to be our floating ribs. We can follow those back up And in between our ribs, we have gaps. So we have our 12th rib, gap, 11th rib, gap, 10th rib, and then we can work our way on up in that direction. But the angle of the ribs are going to come down and around this direction. They're going to be a little less angled the further we get up. Usually what I'll do is find the area of the spinous process that I'm in, think about the angle of the ribs at that spinous process, and just give a little P to A glide on the ribs to see how well they move and to see if they are reproducing any of the person's symptoms, to see if there's one section stiffer than the other or one section moves a little more than another section. So that's all the bony anatomy of the thoracic and lumbar spine that we'll palpate today. Musculature. So musculature of the thoracolumbar region, first area is going to be our erector spinae. That's our big backstrap muscles. It's a grouping of 3 muscles on either side of the spinous processes. What those are going to do is those are going to extend the back. So if Ryan will come up into a kind of a Superman position here, those erector spinae are going to contract on either side of the spinous processes. So they're going from lumbar spine all the way up into the cervical spine. So relax back down. So palpate them as they contract. Also palpate them throughout as they are relaxed to just to see how the muscles feel. Do the muscles feel nice and supple, or are there trigger points at one section? Are there sections that feel a little tighter than other sections? Okay, quadratus lumborum, this is the last one we'll look at on the stomach, is going to be this quadrangular muscle that goes from our 12th rib to our iliac crest, and it catches our transverse processes of our lumbar vertebrae along the way. So it runs from here to here, it runs along those vertebrae. Together, what those are going to do is cause back extension. Unilaterally, what those will cause is hiking the hip up. So they bring the pelvis up to the ribs, or if we're in a standing position, they prevent it from dropping back down. So to palpate that, we've got to get under the erector spinae. So from the opposite side of the area that you're trying to palpate, find the iliac crest, find the 12th rib, and then you're hooking your fingers under and then coming in between. And that is where the quadratus lumborum is going to be. To confirm you're on that, you'll have that person lift their hip up. So pull your hip up just like that, and then it's going to contract under your hands. And then if you will lay on your back, Ryan, we are going to go from superficial to deep with our abdominal musculature. If you'll bend your knees, feet flat, rectus abdominis, that muscle is going to go from our xiphoid process all the way down to our pubic bone. We've got 2 of them on either side of the stomach. That muscle is going to bring those 2 places together. So if you'll do a little curl up, rectus abdominis is going to be right in the middle. In between the rectus abdominis, we have connective tissue called the linea alba. In most all of us, that is going to be pretty tight, not much separation in between the 2, but you will have the occasional person, it happens a lot post-pregnancy, where that will separate and you get what's called a diastasis of the rectus abdominis, and that can separate 2 finger widths, 3 finger widths, 4 finger widths, even 5, 6 finger widths. And you will palpate that by the same test. All right, relax back down. So that is the rectus abdominis. External, internal oblique. External is going to be the most superficial, and then we get to our internal oblique. Those both are going to cause thoracic rotation, but in different directions because the fibers run in opposite directions. So the most superficial, the external oblique, fibers are running in this direction. So it is going to cause contralateral rotation. So as my right one is contracting, it rotates my trunk back to the left. So if I wanted to palpate his right external oblique, I'm going to have him bring your shoulder over into the left, and the right external oblique is going to contract. And relax back down. At that same time, the internal oblique is deep to that. So its fibers are going to run in the opposite direction. So if I'm wanting to palpate his right internal oblique, it is causing left rotation. So right internal oblique causes left rotation, right external oblique causes left rotation. Okay, so if I'm on this side and he rotates this shoulder back in that direction, his internal oblique is what is going to be driving that muscle action. And relax back down. And you can feel the difference when he's turning to the right or to the left, if I'm on the same side, with the internal oblique, you'll feel more of a softness as that external oblique is relaxed under the internal oblique, or under the external oblique. And then 2 more, transversus abdominis. This muscle is deep to both of those layers. Its fibers run horizontal, so it works like a corset. And what it does is, as it contracts, it draws in. So that brings everything in and tightens up all of the abdominal area. So in order to palpate this, we can be in the same general area. I like to come a little lower, just inside of the ASIS, and then have the person flatten out their stomach, almost pretending they're bringing their belly button to their spine, like drawing in. So perform an abdominal draw, and that is going to flatten out and tighten up that transversus abdominis. And then relax. What we don't want is for all of this to push back out. So push out like you're bracing, like you're doing an abdominal brace. So that pushes out. Got my rectus abdominis kicked on, my obliques are kicked on, and it's pushing me out. What you want is for this to flatten out if you're really trying to isolate the transversus abdominis. So relax, do that vacuum again, pull in, and that is that transversus abdominis contraction, drawing everything in. Last one here is going to be psoas. This one's going to be a lot more difficult to palpate. Depends on how, if the person's ticklish, or if you can get them to relax enough to be able to palpate it. So for that, psoas, major and then minor if they have it, is going from the anterior bodies of the lower lumbar vertebrae down to our lesser trochanter of the femur. So we're from here, anterior bodies, all the way down to the femur, and it is going to cause flexion of the hip. So if we find that iliac crest, that's level with L4. It's also level with the umbilicus. So if we find the umbilicus and come out, and then we press down and in, so in that direction, we're going to be heading towards the way that psoas is running. So it's running in this direction. So I want to press in and then move kind of back and forth over that band of the psoas. So if we'll sink in, have them relax, knees are bent, sink in through there, and then we're on it right there. So that's going to be our psoas muscle there. To confirm you're on it, you can have them lift the knee up. Boom, there it is right there. So it's going to contract under your fingers as we flex the hip. And that is all of the palpation landmarks for the thoracic and lumbar spine, skeletal landmarks, and the muscular landmarks.